Hi, everybody. Welcome. Oh, there's already there's already messages in the chat. Great.
Hey.
Oh, hi guys.
We usually just give folks a second to get their audio set up. So if you're here and you can already hear us, hi,
Hello,
welcome.
where are people zooming in from? I am from, I'll tell people.
Ooh, we got Canadians with us.
Mm.
I'm here in Pennsylvania too, Chris.
I
Nice.
love this.
Awesome. We're all over the place.
Every time zone in the United States is represented.
Indeed.
Yay. And we actually have a mixed audience tonight. We're doing something a little bit different. We're partnering with some other rare disease groups because this content is relevant to lots and lots of folks in the space. So we should have sort of a mixed audience tonight, which is pretty cool. So welcome everybody. We're so glad that you're here. I'm going to go ahead and start getting things rolling here. So the title of our talk tonight is AI Tools in Rare Disease, What Every Patient Should Know. This is a patient and caregiver webinar. So I'm Katie Garbarini. I'm your host tonight. I am the clinical programs director here at the Alliance to Cure Cavernous Malformation. I'm also a genetic counselor by training. And just a few quick facts about the webinar. So the total duration is about 60 minutes. We're going to have two presentations and a Q&A. During the Q&A, if you can submit your questions through the Q&A feature, that's how where we'll be able to see them. We won't be able to see them in the chat, so please submit your questions there. We are going to make the recording available on our YouTube channel as soon as we've got the transcript and captions done. And we're really looking forward to sharing this resource with lots of different organizations. I just want to give a quick note. So our Cavernous Malformation Evening Support Group does start immediately following the webinar, so please feel free to join immediately after. And another Cavernous Malformation announcement, our family weekend is coming up in July. And I think we've got one space left. Is that right? Yeah, so we've got just one. If you're on the fence, you're thinking about going, go ahead and get in touch with Darla. We'd love to get you registered and get you on board. Darla, did I miss anything?
Nope, I don't think so.
Okay, thanks, friend. I just wanted to give a quick thank you. So we're structuring this webinar a little bit differently than we have ones in the past. So we partnered with a lot of really great organizations to bring this webinar together. So we're just one of the organizations at the Alliance to Cure Cavernous Malformation. We also had partners at Expecting Health, Genetic Community, Genetic Counselors, Kinetics Consulting, Meet the Moment, Kim, who's here, our speaker, the National Society of Genetic Counselors AI and Machine Learning Subcommittee. But a lot of folks put their time and energy into making a really great webinar, and we're just so thrilled to have partners at these other organizations. So thanks to everybody who put their thoughts into creating this webinar. And then I just want to introduce today's speakers. So our first speaker is Kim Snyder, who is from Meet the Moment. For over 30 years, Kim's helped nonprofits navigate the human side of technology, untangling systems, and supporting teams through mission-aligned change. It's my language right there. I love it. A
Nice.
PMP, a PMP certified project manager and CIPP US certified privacy professional with an MSW. She blends technical fluency with organizational insight. A lead trainer for TechSoup and NTEN, Kim demystifies AI, privacy, and governance in plain English. We are so glad to have you. So Kim will be our first presenter. And then we'll move on to Chelsea Wagner, it's our second presenter. So Chelsea's coming to us from Billion to One. She's a principal genetic counselor there. In her work, she leads patient education initiatives for prenatal screening. She also speaks nationally about the impact that AI has had on the field of genetic counseling. When she is not trying out the most recent Claude model, she's chasing her 3.5-year-old toddler or wrangling her rescue dog. So thank you both so much for coming to share your time and expertise with us. We just feel so fortunate to have expert speakers with us here tonight. So thank you, thank you, thank you. And then we're going to get started with a few audience polls. So just type your answer into the chat, and you can either type the word or you can just type number one, number two, or number three. So the first question is, how often have you used AI in the last week? Okay.
Fair number of daily users.
I'm also a daily user now.
Okay. Couple people getting to know it. That is very good. We're all in the right place, actually.
Great. I'll move on to our next question here. What is your primary AI platform that you're using? One is ChatGPT, two is Claude, three is Gemini, and four is Copilot. Oh, that's interesting. I like that people are putting in if they're using two, which ones they're using. Cool.
And I'm guessing that the primary one is the one they're putting in.
Yeah.
Cool.
So it looks like a real mix too.
Yes.
Cool. All right, I will move on to our next platform here. Our next question is the AI account that you use personal or is it for work? And one is personal, two is for work. Both, yep. 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 Looks like everybody has multiple accounts. Do most folks, I think, have multiple accounts? Jeff, what is three? Both. Awesome.
Cool.
Okay,
All right.
great. Well, I will turn things over to Kim.
Ready. So let me share my screen. Great to be here tonight. All right, where's that screen? There you go. Should be. You can see this okay?
Yes.
All righty. All right, so I'm just going to go over some AI basics. That's what I've been asked to cover. And AI is changing all the time. So it's interesting how you think about this and present it also kind of changes, but there's some principles that remain the same. Okay, so think of when you use AI, think of it, people say, think of it as your assistant, your helper, your intern, right? But the only thing about this intern is this intern comes to work for me and every day seemingly forgets who I am. Or actually, every time we stop a session or every time that intern leaves, I could forget everything that we were just talking about. Okay, so that's unusual. However, this intern has also read pretty much tons and tons of stuff and is eager and fast. In fact, it won't say no, right? It's not going to say, hey, you've asked me that 3 times. Um, and so it's brilliant in general, but without kind of specific knowledge of you or your health situation. And I think with health, it's really important to remember that. It's general, not, not specific. And okay, I'm gonna kick myself now for not turning on the audio, which I may have to go out and you'll tell me. But know that a lot of it is about how you instruct it, what context you give it, how you ask it to give you a response. Okay. But this brilliant intern, and people will say, well, wait, I've been using it and doesn't it remember me? Well, kind of remembering in an algorithm type of way. In other words, like you don't have as much control over like what it's remembering. You can turn on memories and things like that, but it's not in the same way that you would give an intern an assignment and then turn around and come back and they remember what you asked them to do, right? So that's just an important thing about thinking about this. Now I'm probably, tell me if the audio is okay, on this. So this is a video, this video is Tanmay Bakshi, who was probably like 19 years old when I heard him speaking, when I was just starting to talk about AI kind of in the wider world in 2022, 23. And this was the best like explanation of what's going on under the hood in there that I heard, and I
Mm.
still find it helpful all these years later, which Not much of my AI training has carried over from all these years, but this one has. So if this any trouble with hearing this, I will come out and come back in and share my sound, okay?
Okay.
Just let me know.
Say if you ask ChatGPT, what's AI going to do in the future, right? The way that ChatGPT generates a response for you is actually really interesting. It's effectively just entirely statistical language modeling. Given a sentence or given some sort of prefix, GPT's entire goal, its entire objective, is simply to take those words and predict of all the tokens in its known vocabulary, the probability of any one of those tokens being the actual genuine next token in the sequence. That's all that GPT is doing. What you're seeing right now is a genuine visualization of the way that GPT, specifically GPT-2, would generate a response. It's simply taking words and predicting the probabilities of which word will come next.
Okay, so that's a lot to wrap one's mind around, right? So it's not thinking, it's predictive, and it's predictive, like analytics and predictive outcomes, right? It's probabilistic, sorry, it's probabilistic. So whatever's has the most highest probability of being the next word, right, in its known vocabulary is what comes out next. Now, know that it's consumed a lot, and it's certainly consumed even much more and more and more as people give it more data. But the fact that it's kind of probabilistic statistical outcomes as opposed to thinking, when it can feel an awful lot like you're talking to someone, it's not thinking. And that's an important thing to remember, right? It sounds like it's thinking, but it's not thinking, right? And that's very different from technologies we've had in the past, right? You think about Excel, that's deterministic, right? A formula in Excel is the same as it was 20 years ago, guaranteed, right? You might have a nice ribbon at the top that you didn't 20 years ago, but that's about it. The stuff works exactly the same. This is probabilistic. And what that means is like it's never going to give you the exact same answer twice. Or if you're making images, it won't make the exact same image. It can come pretty close now, right? That's part of how it's improved, but know that it's probabilistic in terms of how it's generating its output. All right. So, and for that reason, it can sound very, very confident and correct, but not be. Right. And I heard I was looking at some of the responses that people had to the registration questions, and someone had mentioned that if it doesn't know the answer, it could lie. Well, it's not so much lying. It's more that its probabilistic response could be an incorrect one. I kind of think of it more in that vein, right? It's not lying to you like give like misinformation style lying. Like I'm just going to give it wrong information and it doesn't matter, right? It wants to give you an answer. And in fact, the lawyer, and he got kind of famous for all the wrong reasons for this, and they still are doing it actually. That which is I really don't understand. Like lawyers are still getting busted for asking cases from like AI systems. And you know what? It makes up the perfect case that never happened, but it fits whatever the person is asking for, right? So people have used cases or precedent that didn't ever actually happen. And that's the stuff you read about in the paper. And because it generated the perfect response, it generates what you want, right? So the goal of AI is to try to give you what you want, what based on the request that you've made and the shaping that you've given that request, the output that is most likely to say get a thumbs up from you, right? So, and the fact that it's warm and reassuring and agreeable by design is, not surprising. These tools, they still are commercial businesses. And, if a tool was like really nasty and insulting you, are you going to use it? Probably not, right? So these tools, can be, and they go sycophantic, right? Can make like, oh, that's such a great idea, right? So, that's what they're designed to be. In fact, was one person I work with was like, I want one that's going to really push back and be obnoxious. And so he made like a GPT that did that. That is like, that's fine, right? You can ask it to do stuff like that, but by and large, out of the box, if you use them, they are going to be nice, helpful. Sure, let me do that for you, right? And the tone can feel like caring, and it's also a design choice. And know that, like, the AI knows what you're giving it. Like, that's what you have control over. It knows what you're giving it. The AI is like a mirror that amplifies what you give it, right? Um, so it does, it can amplify distorted ideas as well as anything else, right? And you every once in a while we'll hear about those stories, how someone really goes down a rabbit hole with AI. And I will say that if you're using AI, here's a pro tip, if you're in the middle of using it to, say, work on an essay or have it give you a response to something, and you sense that it's starting to go off the rails, that's an indicator to stop that session and start a new one. It's not going to get better. Okay, it's not going to like straighten itself out, because it's like, if you think about it, it's kind of a spiral, right? So, and if it starts to give you the wrong answer, it's kind of its predictive system is going to kind of keep going, predicting in the wrong direction, right? So just know that sometimes they can go up, or sometimes we give them too much information. Analyze these articles, and we give them like 15 things, and it's like a jumbled mess. A friend of mine once gave, I forget, one of the ChatGPT like a bunch of family pictures, and wanted like a perfect portrait of their family, like their sisters. There were like 7 sisters, like in a different background, right? But what they got were like the 7 sisters, but all mixed and mingled. Like it was like all one person 7 times. It was a combination of all the days. So, so those the ways in which it can go off the rails. And just know that that can happen. It can be incredibly helpful. I use it constantly all day long, but it can also be wrong. Um, all right. Free is never free. All right. We all learned that lesson from social media, I think. But same lesson carries forward with AI. That said, what's different about AI tools, even the free ones, and social media, is that you can turn it off. You can turn off the data training. You can say, no, thank you. And I recommend that everyone do this as a matter of course, even if you're using AI only for the most boring and prosaic kind of work purposes imaginable. When you say, I don't care if this gets shared. If this got published across the New York Times, I would not care, right? I still don't want to train an AI system with my prompts. That is, I am a privacy person. You saw the CIPP US credential. I'm privacy first, actually, before AI. So don't give it your data. No reason. They have plenty. They don't need your data. They'll be fine. So, and I asked about the one of the questions about personal versus workplace AI. That was intentional. All right. When you're working on a workplace tool, this Google Workspace or Microsoft 365, which is Copilot, which has not been that great. And I saw there weren't that many people using it. And they, for some reason, I don't know, that's a whole weird story. But when you were in those systems and logged in with your work account, you have the same kind of protections that you do that a document in your organization's Google Workspace or SharePoint has. Okay? You have enterprise level security. If you're on a personal account, you don't know, right? And if you can turn off you can go to settings. It's often in the same place. Go to settings. It's usually under privacy or data controls, and switch that thing to off. That's true whether it's free or a paid, like ChatGPT or Claude account. That said, you think that, well, I'm paying for it, so they're not going to use my data, right? They're not going to train on it. No, you've still got to go turn that off. All right. And since people are using health information and asking for that kind of stuff, I definitely would turn that off. And what you get that's different on a paid account isn't the guarantee of like privacy, because you can turn it off, but you have to do it. What you get from a paid account is better AI, okay? And it's worth it. The AI is much better if you're paying for it than if you're getting it for free. right? It's like low grade AI. And now ChatGPT has like a free model, but it's also feeding up ads. I don't even want to go close to that. Okay. That's gross. If you want, like, oh, don't go there, AI, but they did. Okay. Because it's too expensive for them to keep. All right. So protect your privacy. All right. This is kind of a tip that I ask, especially when I'm asking it a question where it's really important that I get the right type of answer, or that as much as possible it corrects itself. I tell it as a general rule, if you don't know, tell me. I'd rather have that. Do not ever make anything up, right? And when you can put like memories and instructions and rules in these systems, that's one of the things I'll put in. Do not make things up. Do not fabricate. Say, I do not have enough information, right? That because it is there to trying to please you. So if that's a rule, then it'll follow that, right? You can also say, show me how I can verify this. Can you show me the sources, right? Those help you to kind of get real responses. All right. Yeah, the real risk isn't the wrong answer that's like so off the wall that it's like, ugh, right? This is so ridiculous. The thing is like almost right or kind of sounds right and confident, and you can't verify it. So the general rule that I say is if you can't verify something and you're asking it for kind of a high stakes question where it's important that you get the right answer, and you have no way of verifying it, and I'd say that is especially true with health situation. If you can't then show it to someone, and this is what I saw, right? I saw some people use it to translate some of the documentation that comes out into more human readable. That I'd say is a better bet because you're giving it something to work with and saying, translate this so that like a fifth grader could understand it, right? And that's a perfectly good use case. But kind of going out there and saying, tell me about this medication or tell me about, I want to then verify that, right? Yeah, lab results, things like that, should I have a surgery? Like that's like to a doctor. And it's tempting because it's nice, it's there, it answers questions. It's like, why not ask it? It's right here. It'll talk to me. I have to pay money. My doctor's not available. But know that it could be wrong. And so you'd want to not make a big decision off of it. You could even say to someone, look, I asked AI and it said this and this and this. What are your thoughts? But that verification step is really how you keep it human for yourself. So that's this is my diatribe on AI and verification. And it's an amazing tool. Okay, amazing, amazing, amazing. But you want to find the safe zone of use cases for yourself, right? So a few takeaways from today, right? It's predictive, right? It's not thinking in there. The fact that it sounds good and confident, it's beautifully written, does not necessarily mean it's correct, right? Let it tell you it doesn't know. In fact, tell you to tell it when it doesn't know. And verify, verify, verify. Okay, I think we go on to Chelsea now. Have I taken up too much time?
That's a perfect tee up.
Okay. All right, so I will stop sharing and
Perfect. All right. Well, thank you so much, Kim. It's fascinating because I feel like we could talk for hours about lots of the points that you brought up, and the chat is fantastic too. So, really appreciate everybody being engaged, and I am so happy to be following up Kim's introduction to talking just a little bit more about some use cases that may be a good fit for you and your journey as a patient or a caregiver with rare disease. But as Kim said, some of these might not feel good to you, or they may not be a good fit for you and your personal health journey. So that is okay. But we are here to kind of talk about how can I make AI my co-pilot? And you'll see it's not a pilot AI because we still want you to be in control. And for many of you, I'm sure you're tired of hearing this, but like you are the expert in your own health journey and your own diagnosis. And sometimes it feels like you're flying the plane and your provider just might be in the seat next next to you. And so that can be really lonely, and we want to get you some help. And that's where AI can come in and help you co-pilot some of these spaces where you might need a little extra help. And so, very quickly, I am employed by a company. I own stock in that company, and I also make resources regarding AI education. So those are just some of my disclosures. And I have used AI to help me generate some of the formatting for this presentation. And so I find it's always helpful for me to disclose when I use AI, because I would love if everybody were transparent when they were using AI, including maybe the healthcare professionals you're going to see as part of your care. And so, in my time today, I want to hopefully accomplish three things. I want to identify some real use cases where AI might be helpful for you, either as a patient yourself or as a caregiver for a patient. Talk a little bit more about what Kim had mentioned. How you build or talk to these tools really impacts the output that you get. So there are some prompting strategies or ways that we can phrase our questions or inquiries to get really effective answers. And then touch a little bit on those limitations that Kim has brought up. And it certainly came across, it feels like we've got a nice bunch of users here of AI, both that have lots of experience and some people with no experience. So Jeff, I saw you in the comments. Sounds like we're not an AI user, and that's okay. At the end of today, we don't have to be. But I do want to point out that in general, when we think about a healthcare setting, this is a huge time suck for people. Where you spend your hours outside of work could be on healthcare coordination. And in fact, there was a survey that was sent out to adults and families in the US in 2022. Results were reported in 2023. And about half of the people that responded said, I myself have helped somebody else get healthcare. And it's either getting healthcare or coordinating appointments, prescription refills, calling to get on specialist wait list. Any of that qualifies as care coordination. And of the half of the adults that reported doing that for somebody else besides themselves, 70% of them said, you know what, this is really complicated. And I think we could all agree with that statement that healthcare coordination is rough and it can be overwhelming. And on average, the individuals that responded to this survey estimated they spend about 8 hours a month on healthcare coordination. You'll notice I put the little asterisk there because it is probably a gross underestimate for individuals that have rare disease or caregivers for individuals with rare disease, because rare disease itself is such a complex and unique healthcare, I don't want to say adventure, but that's kind of the word that's coming to mind. And we know that rare disease care coordination can span many different specialties, hospital systems, records transfers. If you start in pediatric care and you have to transition to adult care, that's a whole other layer of complexity. And if we think about on top of that, rare disease in itself is rare. So information about these diseases, conditions, treatments, outcomes, they're limited. And so that in itself makes navigating and coordinating care for individuals with rare disease probably take even more time than 8 hours a month. But think about what you could do with an extra work day, or two, or three, maybe four a month. All of that time really adds up. And so hopefully we're going to show you some ways that you can get some of that time back if you are in fact somebody that coordinates care. And there has been some really interesting studies that have been coming out, and almost you have to check every day to kind of see where is AI expanding and where is it being used in different spaces. And in 2025, this big consortium got together and put out this guideline or this framework for incorporating AI specifically in the rare disease space. And basically, it identified these different parts or pieces of the rare disease journey as a patient or a caregiver that's, coming along with a patient on this journey. And it said, how can we use AI in these distinct domains? So what and how can we use AI when we just have symptoms? What about once we have a diagnosis? How can we use AI to help us identify proper treatments or future therapy targets, and so on and so forth? And so this paper, which by the way, I was able to have ChatGPT summarize the key points and highlights for me. It basically identified, you know what, in these different domains, there are really specific things that AI could be good at. And I will highlight even just this first one for those that are not yet to a diagnosis, but have presenting symptoms and they're trying to get a diagnosis, which can take on average 5 to 7 years in the rare disease space. AI can really help speed up medical record review or sort of collaborating and putting all of these medical records together. And there was a study that was just published in the New England Journal of Medicine, and all the press releases came out literally 18 hours ago. So if you're on your computer, just Google rare disease diagnosis in AI, and basically OpenAI, which is the powerhouse of ChatGPT, was able to re-review medical records of close to 400 individuals who have previously gone undiagnosed with various symptoms, and eventually the AI tools were able to identify candidate differentials and like potential explanations, and then it was verified by physicians and clinicians and laboratory testing. But AI was able to comb through hundreds of thousands of medical records and identify causes for these symptoms in 20 of those patients. So as a result of working in collaboration with physicians and these AI tools, they were able to get diagnoses for 20 people that have gone years without a diagnosis. And so that's just one example of how AI can sort of speed up some of this journey on a rare disease sort of timeline. And we see that again, very effectively being able to find therapeutic targets or repurpose drugs or treatment that are available right now for different diseases for rare disease, because it can speed up that research process. And you might be like, okay, well, that's cool, but I'm not doing research and I'm not identifying drugs for rare diseases. So what else can I do? And that's a great question. So if you are still in the process of finding a diagnosis or getting a diagnosis, that's a tough place to be. And you might be looking for some help. And here's where AI could help you in this pre-diagnosis journey. We all know that there's lots of technical and medical jargon, and as Kim pointed out, a really good use case of using AI is to take something that's written in, something you're not a specialist in, and say, hey, explain this to me like I'm a middle schooler, or explain it to me like I'm a parent of a child that's experiencing these symptoms. Maybe it is a way for you to help prepare for appointments so you feel like you're on the offense instead of on the defense. You can go into a specialist appointment and already kind of have an idea of here's what they might be asking me, and here's what I might want to ask them. And so it can help sort of empower you even more than you already are to feel prepared and take charge of these multiple appointments that you might be coordinating. And then I'm going to go a little bit more into how you might use this to organize your symptoms or a timeline, create sort of this medical summary document if you feel comfortable. But these are all sorts of things you can do while you're waiting to have a diagnosis. But many of you on the call today might already have a diagnosis. So how can I use AI right here, right now? And there are a couple of use cases that I'll go over. And I actually saw some of these mentioned in the survey that you guys took when you were registering for the webinar. So I will actually I'll start with this middle one because somebody had mentioned, hey, I put in a research article and I asked for a summary, I got it out, and then I turned it into a podcast. Like, how cool is that? That you can take this, niche area that you are not an expert in, but you're not trying to become an expert. You're just trying to become somebody that knows a little bit more about that topic, and AI can help translate that in a way that resonates with you. And what I particularly liked about that example, whoever you are, thank you so much, is that you used AI to give you an output that was likely words or like written first. And then you said, actually, I want something else, and let's turn it into a podcast. And so the beautiful thing about generative AI is that it can generate not only text, but it can generate videos, images, podcasts, charts. It can do data analysis. It's really powerful. And so as we go into more examples, just keep in mind that you can ask for whatever you want. And sometimes, and in fact, lots of times, if we use the right prompt, we can get what we are looking for or what works best for us as individuals. So I myself am a very visual learner, and so I may ask for a written summary of something, and then I may ask AI, now give me a visual analogy. I'm having trouble picturing this. Like, walk me through what this concept means or what this term means. I did it with a very complex statistical theory that I have to know as part of my job. And I said, explain it to me like I'm five. And it gave me an analogy about cookies. And I was like, I can roll with this. This I can understand. And so it has this ability to translate this really complex information. So great if you've got a research article or if you found something on your own time and you aren't going to a doctor's appointment soon, you can use AI to kind of give you that summary or the highlights. And we've kind of touched a little bit too about how that can result in you getting this personalized education about whatever you're looking for, whatever topic. But imagine you're a new parent that is navigating a child's diagnosis of something, and you're like, what does this even mean? Explain it to me like I need to explain it to my child, and then explain it to me like I would want to know as a parent, and what are some things I should be thinking about in the next 2 years, in the next 5 years, in the next 15 years. So you can use that as sort of a bouncing, a backboard, if you will, of, okay, I have this new information, I'm adjusting to it. Let's think through what this could mean for all of these different people or different stages in my life. And then finally, I won't touch too much on it, but if you are eligible for a clinical trial or want to see if you're eligible for a clinical trial, the documents that you have to submit if you're running a clinical trial are just insane. Only if you are a scientist are you going to understand what that's saying. So if you ever become eligible, an AI tool may be able to help you sort of distill down, here's what this clinical trial is about, here's who's eligible, and here's what it would entail. So those are just some areas if you're currently having treatment or undergoing treatment that you could use AI. And then this last section is really just thinking about outside of medical appointments or getting information. Like there's just a lot of work that has to be done if you're living with a rare disease or with a chronic health issue. So how can I utilize and leverage AI to decrease the administrative burden? And if I ask you to make a list of all the things that you do that is related to care coordination, you might start with the really obvious things like scheduling appointments, getting prescription refills, getting referrals. But then I would hope that as you start to list, you realize, wow, a lot of things I do are related to caring for either a person with a rare disease or myself for a rare disease. So finding resources, community support groups, those are things that are related to care. If you have a child and you have your yearly or annual IEP meetings to draft or create those plans for your child of this is what we need in an educational setting, think about how much time you might be able to save to either record those conversations and transcribe them later, or draft those communications, or write out all of the thoughts that you have before you go into those meetings. Or heck, if you get an insurance bill or an EOB in the mail and you freak out, that's a chance that you could, if you feel comfortable, use AI to help you explain terms or what is exactly on your bill. And so those are all just areas that you have probably encountered and maybe don't always put that in the bucket of, oh, this is healthcare. But there are so many realms that are involved in just caring for anybody that AI could be useful. And so this is the part where we talk about, well, how do I use it? Those all great ideas, love it. I'm ready to go. I'm at my keyboard. That's when prompting comes in. So prompting is really how you communicate with a particular tool. And it's really important that you are intentional when you communicate so that you get really robust outputs or answers for the questions you're asking. So these three things are always great to think about adding to a prompt. And again, a prompt is just like, what are you asking that tool to do? So instead of just saying, tell me about this condition, you can provide some more context and say, I'm newly diagnosed with this condition. Tell me about the key features in plain language and suggest questions I should be asking my specialist when I meet them for the first time. That's going to get you way closer to maybe what your specific situation is rather than just being like, tell me about this. So tell me about this and why. Same with the specifying your level. I think Kim and I have both hit on this. It's great if you kind of give the tool context for where you're coming from. It's not to say I'm not intelligent or treat me like a fifth grader, but it's more so like this is not my area of expertise. I want you to help me understand this. And so if you're asking for an explanation, give it a role. Say, I am a parent, I am a caregiver, I am a person with this. And that will also personalize the output. And then same for the asking for what you want, asking for the format. This is where you get to ask for whatever you want. So if you love bulleted lists, you're like, give me the summary of this really complex paper in bullets that I can read quickly. Or I want to create a very elaborate spreadsheet to track my symptoms so that I could share that with my healthcare provider at my next visit. These are the things I need to include. You can be specific, and the more specific you are, the closer the output will hopefully be to what you are asking for or looking for. I'm not going to go over all of these prompts, but they're going to be available on the slides. But these are just examples of more specific prompts that you could use in these different scenarios that you might come across. I'll point out this medical timeline down here at the bottom right. I myself have chronic illness and I see many specialists, and it's really hard to kind of summarize me when I'm going to see a new provider. And so I actually take almost like a resume with me, and I'm like, here's what you need to know. And if you're comfortable doing that, it can be a really great tool to keep track of. Here are my symptoms. Here are the major milestones. Here are any treatments or drugs that I've tried previously. Here are my hospitalizations. And so you are now summarizing this wealth of information for your provider. And if you think about it, that's exactly what we're trying to do with AI as users. We're saying, take all this complex, really hard stuff that I don't have time to read through every single line and tell me what the key points are. And now you can hand deliver that to your doctor, who now is going to be like, wow, this is so helpful. Thank you. I'm going to go confirm everything with what I can find in the medical record, but it's a good place to start. I do have a prompt library of about 20 different prompts that hit on different aspects of healthcare coordination that I'll share with the attendees after this. So that will be available. But I'll just end. I've got a couple minutes left here with thinking about those limitations. So as I am a cheerleader. I love using AI and I want people to be excited about it. There certainly are limitations that we need to be aware of and think about as you are using these tools. So hallucinations is just that idea that Kim brought up, that you could have incorrect information given to you and it could sound really convincing. And I think that's the scariest part, right? If you're not careful, or if you get really into it and you start trusting everything that comes out of AI without verifying, then you could have an oopsie, or even worse than an oopsie. So we have to be absolutely on our guard and verifying any information that comes out. These two catty corner green I guess, squares, the rare disease data gaps and the bias in training data, we can't touch on too much today, but it's this idea that these models were trained on available information, and that available information is limited to what we know. And as you know, in the rare disease space, we don't know everything. And in fact, we know very little. And so that means if we're asking AI specifically about rare disease, there may be some gaps. And because there is gaps, but the tool still wants to give us an answer, it may hallucinate, or it may, give you an answer that is incorrect. And then finally, this does not replace your clinician. Again, we'll go back to the title of this talk. It's a co-pilot. It is not taking over. It's not flying the plane. And we are not gonna, fall asleep while AI is running things. So everything should be done in combination with you, your instincts, your healthcare team, and just your knowledge that expands as you go. And these 3 points just kind of pull all of that together. So, how do we verify this information when we get it? You check with trusted sources. So sometimes that's a little bit easier if you use a certain type of strategy when prompting that I'll show you. You bring the output to somebody you trust or somebody that is an expert in that area. And exactly as Kim said, hey, I got this from AI. What do you think? And then trust your instincts. So if you're like, that sounds too good to be true, probably is. And we want to trust that instinct and go through these steps to make sure we have, accurate information. This is the last prompting strategy thing that I will leave you with. This will also be in a handout. It goes over 10 strategies to use to not completely eliminate the chance for hallucinations or incorrect information, but it can help safeguard you. It's sort of guardrails for using this. So tell the AI that this matters. This is part of my healthcare. It's important you don't hallucinate. If you don't know, say you don't know. There is also on the second page of this, which there's not a screenshot of, you can ask for the sources or citations. So I think Kim brought that up as well. You can say, where did you get that? Or walk me through your reasoning. How did you get to this conclusion? Or that number sounds like nothing I've ever heard before. Show me where you got it. Those are all ways that you can challenge the AI. And in that way, you can not just take what it gives you, you can interact with what it gives you. And that also helps you turn on your critical thinking skills, which is what I always tell students that are learning how to use AI. This is a great chance to look at something that's given to you and say, what else should I be asking? So that is okay to do here too. So these are the 3 things hopefully you've taken away is you can use AI to help you organize, understand, and prepare for some of your care coordination. And by doing so, you can save yourself some real time. But ultimately, it's not just AI, it's not just you, it's not just your provider, it's everybody working together in order to have the best outcomes. And so that would be, I guess I should put like flashing lights right there. So we don't want to use it by itself, but we do want to use it in a way that is responsible and also helpful. So with that, there's my email address, and I think we're going to have some time for questions, barely. Sorry. No, this is great. We're like, I feel like Darla and I are both like learning so much. Like this is just so, so helpful. And we already have a question in the chat. So again, when you all have questions or not in the chat, it should be in the Q&A. Just type those questions right into the Q&A so that Darla and I can see them. So the first question is, I'm concerned about the environmental impact of AI. So, carbon footprint, freshwater and natural resource depletion. What, if anything, is being done to curb the impact that AI is having on our environment? Thanks. Oh, you're on mute, Kim.
I can try to answer that, and I can actually share with you a tool that we have at Meet the Moment to think about that. I mean, it's always trade-offs, right? So do I drive gas or electric? Do I fly somewhere? Do I make it? What are my decisions? Like there are like and yes, AI, the industry of AI, just like the industry of gasoline or fuel, right, has some real downsides. And I think, one of the reasons why I got so excited about nonprofits learning about this technology is because we need more human-centered people at the table. We do have a tool, which I can take 2 seconds and show you, that's just a different way of thinking about AI and usage. And think about what are the queries costing us, right? And the impact calculator, right? So I can look at, okay, if I'm going to eat a hamburger, this is where I'm always kind of like, I don't eat meat, right? So eating a burger is the equivalent of, in terms of burning energy, like 1177 AI queries. So it's just a different way to look at that and looking at it as choices that we make, right? The real cost of this is in data training, okay, for sure. But when we think about our own uses, and of course we want, and that's why Chelsea was giving some really great tips on smart prompting. The smarter our prompts are, right, the less we have to go back and
Mm.
forth, the faster we're getting to real information that's helpful. And so the less queries we're having to burn through. But I know that's a shocker for a lot of people. I'll drop the link for that in the chat here. But it's just a different way to think about it. Maybe people will eat less steak. Um, but yeah, um, and advocate for sure. There's been a big pushback, and that's important.
Mhm.
Yeah, Kim, I will just add, I think that this is a topic that I get the most questions about, no matter who I'm presenting to.
Interesting.
Yeah, it actually is. It's forced me to do a lot of research just into it, but Kim, I'm not sure I've heard anybody explain it so succinctly. It's about the trade-offs, it's about the decisions, and I will also say that as an individual user, it would be very difficult to make a dent in AI use. I think of it almost like recycling. Like I will recycle this can when I'm done drinking out of it. But ultimately, like there are bigger policy changes that have to be made
Mm.
and better guardrails at the like top level. And so I am absolutely going to do my individual part and be a smart AI user. But I will also, as Kim said, advocate for policies and I'll just leave it at policies that support responsible AI use.
Thanks, Chelsea. I actually have the same question as this person in the chat. So the or in the Q&A, the person says rare disease patients need to be self-advocates with our doctors and medical professionals. Yet I think my care team might get upset and change how they interact with me or treat me or communicate with me. How do we balance our need to know and their lack of knowledge about our rare condition or other rare conditions to make sure our doctors don't treat us poorly? I wonder, like, too, if you'll have strategies for like, so it doesn't come across as like, well, ChatGPT told me or Claude told me. Like, how do you get the most out of that dynamic with your healthcare provider? What would you all recommend?
I have seen this quite often. So I speak with patients every day, just mainly about their pregnancies, but very often people are coming in with information that they have from some source or another. And I think it actually is an opening for a conversation with a provider. Or I would hope a provider would say, like,
Mm.
wow, you came really prepared today. I'm wondering, like, where this is coming from. Are you feeling nervous? Were there questions we didn't answer next, at our last visit? What is really motivating you to feel like you have to do this by yourself. That would be what I would want my provider to do. That being said, neurosurgeons or other surgeons, they certainly could react differently. There are some health surveys out there that go out to healthcare providers, and it's about 1 in 3 patients will bring in information that they've got from an AI, LLM, or ChatGPT to appointments now. So I think it's actually going to have to change some training that healthcare providers themselves have to sort of navigate those conversations. But I think a good approach as a patient is just saying, hey, I was doing some research. I was really curious about XYZ. This is what I found. I'm wondering what your thoughts are because now you're bringing the provider in and saying, like, what do you think? I would love to hear your opinion, and giving them that opportunity to step back into that professional role or that expert role.
Yeah, it reminds me, like when I've been talking to clinicians about like AI recently, like it reminds me of like we used to always talk about Dr. Google, which is the same sort of like people were like, well, Dr. Google told me this. This is like I it's been really interesting talking to clinicians and seeing like how they're figuring out how to respond. And I think that like I was really reassured that most of the doctors I've talked to are really engaged in thinking about like how can I incorporate into my practice and how can I respond effectively when people ask me these questions. Kim, did you have anything you wanted to add?
To that, yeah, no, I mean, I kind of turn it over to you more as the experts, but in general, I don't say, I went to Dr. Google and, blah, blah, blah. But I do, I couch it as research because that is essentially what it
Mm,
is, right? I've been researching this. This is what I've learned. You know, what
yeah.
are your thoughts on that? Um, yeah, you don't want to put someone on the defensive.
Yeah. I really like that.
One
I
thing
really
I
like
want
that.
to add to
Yeah.
the environmental one is, and just in general, those trade-offs. When you think about, like Chelsea was citing amounts of time that people spend on having to coordinate care, right? And the tremendous amount of time and energy that goes into that, and that energy being able to be used for something else is that's also part of the trade-off, right? Also similar thing for nonprofit staff or caregivers,
Mm,
right? If that gives you, if that affords you more time for your mission or for people, well, that's also then part of the trade-off, right? And,
mm,
you know,
And much harder to quantify. I think that's the struggle with AI is like it feels so techy, but like at human-centered approaches, it's trying to figure out that core, like how do we exist in a world that has a super powerful technology while keeping all of the really great human parts about us and about society.
I'm just replying to one question in the chat, which I get okay, good, it should be in there now. But I was asked if our CCM centers, if I'm seeing these physicians, and that's exactly where I'm seeing it, is at our CCM centers that folks are really interested in AI and really interested in like how do we respond well? How do we sort of reframe that information? It's always something new in medicine, right? Like they're always learning how to interact with the newest thing patients are bringing. So, I know we're getting to the end of our time here. I think maybe if there's one more question.
There was a question in the chat that might be interesting, and basically
Yeah, go
the
ahead.
question is, what do you guys like? Claude, Gemini, what are you guys using?
uh, I'm Claude. I use all of them, okay, because I teach it. So, but I am personally a Claude user.
I was a huge ChatGPT user until I learned the power of Claude, and now I'm like a total Claude convert. So I think it's really dependent on what you're using it for and what's accessible to you, but I love Claude.
Yeah, ChatGPT is the Swiss Army knife of them because it does like
Hmm.
images, it does really good images.
Yeah.
So does Google Workspace.
Yeah, Gemini is
Gemini is like
fantastic for
really
images.
good images.
That's where I got my headshot from on my PowerPoint.
Yeah. And I'll say my slides were all made with Google Notebook LM. Okay. Now, if you're in Google Workspace, we were giving a whole accelerator series on this. On Google Notebook LM is the Ferrari that's sitting in nonprofit organizations' garages that no one's driving. It's really, there's some amazing tools that come with the Google Workspace for free for nonprofits.
Mm,
Okay, cool.
Basic nonprofit plan for Google users, Google Workspace people.
nice. We like free.
Free's always good, and it's amazing.
That's
All
great.
right. Any final thoughts in the last minute here?
Thank you guys so much for organizing. I was so excited. And what a fun interactive group. I appreciate that.
Yeah, no, I learned from you. Thank you, Chelsea. That was really helpful to
Yeah.
and to contextualize it in the way you did.
Perfect.
Thank you so much to our expert speakers. Darla and I had this dream last year that we would do this webinar, and we are so excited to see it happen. It's almost a year in the making, I
Oh,
think,
yes.
bringing these folks together, getting all these pieces lined up, and we're just so thrilled to see this webinar happen. And we're really excited for it to be sort of a resource people can use for a long time, as long as we can in this AI world, right? Like things are changing all the time. But yeah, Yeah, thank you so much. And as a reminder, our Converse Malformation Support Group will start immediately. Again, we just are so, so appreciative of your time and expertise. Thank you so much for coming
Absolutely.
and
Thank
being with
you.
us today.
All
Thank you
right.
guys.
All right. And
All right.
take care, everybody. Bye-bye.
Here.
Bye.